afternoon. Welcome to the Tri-City Hospital District monthly meeting for May. We do have a quorum, and we are minus our board member, Mrs. Reno, today. So, Mrs. Mitchell, would you be willing to lead us in the Pledge of Allegiance, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. At this time, members of the public may address the board regarding any item listed on the board agenda at the time the item is being considered by the board of directors. For Board Policy 14018, members of the public may have 3 minutes individually to address the board of directors. Members of the public may speak on any item not listed on the board agenda which falls within the jurisdiction of the board of directors immediately prior to communications. If you would like to speak, please see Mr. Crooks. He has a yellow sheet, and that will allow you to place you in the proper order if you need to address the board. So thank you very much, and let's start with item number 12, our special recognition of Nurses of the Year. Sharon, can you take the lead?
Sure. It's my pleasure. You know, every year we celebrate National Nurses Week during May, during Florence Nightingale's birthday period. Her birthday is actually on June 12th. And we have nominations throughout the House for our Nurse of the Year and actually our Support Person of the Year, because the nurses can't do it without help, right? So it's my pleasure to bring up Imelda Browning and Rachel Garcia from the telemetry unit. And Rachel's just going to talk a little bit about what Imelda did.
Come on up, Rachel. Don't be shy.
Good afternoon, everybody. Imelda Browning has 38 years of nursing experience. She is very welcoming, very warm, and very attentive to her patients. She also is a very good resource to her peers and always eases tension with a positive attitude in a very busy environment. Imelda possesses a key component that can never be taught, and this is true compassion to her fellow man. We had a patient, a homeless patient that we are sending home. And this patient was crying hysterically. We have the security officers, we have all the ACTs and nurses trying to help her and try to ease her down. But the patient was crying because she was being discharged and she doesn't have any shoes. So, so Imelda, who was on her way out, heard the patient crying. And this is not her patient. She walked into the patient and asked the patient, "So why are you crying? They're sending me home without shoes." And so Imelda, without any more questions asked, removed her shoes and gave her shoes to the patient. Everybody who saw this started crying because this is a simple act of kindness that we don't see often. She touched everyone's heart. And when I heard this story the following day, I started crying too. So that's why we chose Imelda as our Nurse of the Year.
That story has been told so many times, and it never gets we never get tired of hearing it, I think, for the wonderful thing that she did for one of our patients. Next, I'd like to bring up Luke Galiendo and Sharon Davies. And Luke works in Maternal Child Center. So for a man to be working up there and get the award from everybody, you can imagine how wonderful he is.
Luke, again, works in predominantly a female field, and what really stuck out in all the employees' nominations was the respect and courtesy that he exhibits toward our female patients and toward his coworkers. Luke has never said that that's not my job. With Women and Newborn Services, you almost like run a mini hospital with labor and delivery and the ORs. And Luke is an OB tech, and he's been with us since June of last year. And he always helps everybody in the department so that when we have a busy day, that everything goes a lot smoother. So we were really proud when he unanimously won. We didn't expect, because he had a lot of competition with all the other patient care support people that were presented. But Luke also helps throughout the hospital in that we have patients in the forensic unit and we have equipment there. He makes sure that equipment is okay. He picks up patients in the emergency department. If he's not busy in the OR, then he's answering the phone. So we're really proud to present him to you. And we need to tell you that we're sad that he is going to be going to nursing school in August in the San Francisco area and becoming a nurse. So I really feel like that a sign of an excellent place is those people that you send out into the profession, and he will do us proud.
Thank you, Sharon, and your team. Appreciate that very much. Now, Mr. Knight, can you come to the podium, because I think we have a very special person to introduce to our community.
Yes, sir, we do, and I'm actually going to have 3 people come up and join me. So Dr. Sharona Ben-Hein is going to come up here, and Dr. Greg Sahagian and Susan Hadley. So if you guys could come on up. I first want to introduce Dr. Ben-Hein to you. This woman has a 4-page CV, okay? So she did her undergraduate work at Cal, and she got her MD at UCSD. She comes to us most recently from Oxford, England, where she was with the Department of Surgery. She was also the chief resident at Mount Sinai Medical School and managed to put in some time at Yale. So Dr. Ben-Hein is here. Go ahead and please speak.
Hi, everybody. Thank you, Wayne, for that very kind introduction, and thank you to the Board of Directors for having me here. These are very exciting times with this new affiliation with UCSD, and I am thrilled to be a part of the forefront of inducting this collaboration, and specifically in providing high-quality neurosurgical care to the members of the Tri-City community. And very excited to be poised in a wonderful position with my affiliation with this hospital, as well as with the Neurology Center. And thank you very much for having me. I'm very excited to be here.
And then I've asked Dr. Sahagian to say a few words, because Dr. Ben-Hein will be in Dr. Sahagian's, well, not his office, but his group's office. Dr. Sahagian is the president and CEO of the Neurology Center over in Carlsbad. So.
Thank you all. We're very excited to have her join the community. It's been a long desire of us to develop neurosciences further within the community itself, and I believe this will take us to another level. She comes with training that doesn't exist in the community currently, and we're very interested in developing that further, as we've had lots of discussions about. So onwards and upwards.
And then lastly, and this will be it, I want you all to meet Susan Hadley. She's our Director of Network Development. And as in many successful operations, she's the brains behind the whole affiliation thing. I'm just a spokesman. So this is Susan. We're very fortunate to have her. As a matter of fact, when UCSD found out that we hired her to direct the network affiliation, they're like, you know, we were going to hire her. Thanks a lot. So.
Thank you very much. It's great to be here and part of this affiliation. It's awesome. I worked at UCSD for 17 years, and it's so exciting to be here and working back with the many friends and colleagues I had there to bring the great medicine up to your community.
Thank you all very much.
And Dr. Ben-Hein, Then let's get on to item 14, and that's a presentation from our Dr. Ponick and Steve Young about our new GE 512 CT scanner, which we're all pretty proud of. And Dr. Ponick's going to tell us why we should be proud of it.
Yeah. Yes, well, Steve won't be able to be here for this, but I've been asked to say just a couple words about this. So I'm Don Ponick. I serve here as the department chair for diagnostic and interventional radiology and the medical director for the Cardiovascular Health Institute. So and this is pretty relevant to that area and to all of the things we do here at the hospital. So Tri-City has two CT scanners. There's a so-called 64 slice scanner over by the emergency department, and then we had a single slice scanner. CT has become so central in the way we evaluate and manage patients, especially the acutely ill and injured or ambiguous presentations. It's become very, very central in the early management and ongoing evaluation of those patients. So we really were in need of a second scanner. Our old single slice scanner was end of life. So we really knew we were going to replace that scanner with a 64 slice scanner, and the hospital administration had budgeted for that. But then came conversations with the foundation. They're looking for things where they can invest in sort of good to great. How do we wisely spend money on things that are relevant? And so they offered to fund the acceleration of that scanner into the newest version of these types of imagers. And that would be this particular scanner. This is the most advanced scanner you can buy today. It's the only one in Southern California. And, you know, not to be so proud about that, but it's just really to give you an idea of how this really makes a difference between where we were and where we're going. The emphasis is really on three things. It's on, first, the quality of service we deliver. The second is the safety of the testing and interventions that we do. And then the third is the efficiency, because we're all interested in delivering more value today. So maybe we'll look at the next slide, or do I have that? This is me. So Steve Young put this in just as a sort of a historical reference, but just in our lifetime, most of our lifetimes, this technology has evolved enormously from the first scanners, which were in the early 70s, which would acquire a scan in 5 minutes. A scan meaning one cross-sectional image. Took about 2.5 hours to process that, and the computer was as big as this room. Now these scanners have evolved from sort of single slice scanners to now you'll hear multi-channel scanners. So instead of acquiring an image or a slice, as we used to think about it, it acquires an entire volume. And that makes that's a qualitative difference. It's not just faster, it's really different. And it happens very quickly. The scanner can acquire now a 16 centimeter field of view, which will cover the whole heart in less than a quarter of a second. I mean, you'd have to see this to believe it. You sort of go, okay, hold your breath. Okay, thank you, we're done. It's just, it's like that. And it's not, that doesn't really help so much with the throughput, because that's not the limiting factor in terms of how we get patients through the scanner, but it changes qualitatively what we can do, because it freezes motion, it acquires a volume that we can look at in very different ways. Some of the areas that this is really relevant to our patients is in emergency stroke analysis, cardiac care. Essentially, a scanner that acquires that volume of data that quickly means that within one diastolic portion of a heartbeat, the entire cardiac structure is imaged. Advanced vascular and cancer staging, really dramatic radiation reductions, and this is where the safety comes in. So in addition to being faster and enormously powerful, these machines now actually, kind of like rather than an incandescent bulb, you have an LED, you get a lot of light with a lot less power. Sort of an analogous thing. We get a lot more image data for much less radiation. So we can do a cardiac scan now at about 1/10 of the imaging exposure that there used to be. And taken to the extreme, the scanner now looks at, actually, believe it or not, it's sort of like an astrophysics thing. It looks at the noise that's coming out of the scanner and reinterprets that back into an image to the point, whereas if you push it all the way to the extreme, you can do a chest CT with less radiation dose than just a chest x-ray, which is really a startling advance. I mean, people don't realize it because it all looks the same. You go and look at the CT scanner and you go, yeah, looks like a CAT scanner. But it's really, really a very different machine. Also allows us to reduce contrast dose. So it's all safety. This is just a physics thing, shows that we see much better. What I wanted to tell you is that by that qualitative change I mentioned, so now you're able to look at things not in a slice, but in a volume, and it doesn't have to be, the structure doesn't have to be straight. We can follow curved structures, take a coronary artery basically off the surface of the heart, straighten it out and look at it and try and figure out what's wrong. And it's sort of mind-blowing when you think about that sort of thing, because you're really seeing inside the body in a way that we really couldn't before. You can't do that by looking inside surgically. You don't get this information. So it's really revolutionary. These are just a few images of our patients, and that one on the bottom in the middle is one where we did just that. We took a coronary artery that's a curved structure meandering over the surface of the heart, straightened it out, and you can see what it looks like. And this allows, this particular set of images is meant to talk about one other thing that we run into, and that's patients who come into the emergency department with chest pain, and we're not sure what the cause of the chest pain is. So it could be a blood clot that's traveled to the lung. It could be a coronary event, so a heart attack, or it could be a tearing of the inside of the aorta, a dissection. And many times it's not clear what's going on. It's hard to know sometimes exactly. The scanner will actually allow you to do a so-called triple rule out. You can actually look at all those three things at the same time and within a second have the answer. It's pretty crazy, big advances. So how does this affect our workflow? Well, having two scanners that have these types of capabilities and then the extra capabilities of the 512 have really helped our throughput through the emergency department. This is also part of the value component of this, the efficiency. We want to reduce length of stay in the emergency department. We want to be more efficient in that if somebody has atypical chest pain and we do this scan and can absolutely exclude the presence of coronary artery disease, we can send that patient home with safety. And that patient doesn't have to be admitted, go through further testing, incur the added cost and expense and risk of that additional work. So it's a very exciting time for us. Be happy to take any questions. That's really about all I had to say. Oh, I have to tell you one thing that's really interesting. The scanner, even though it has all this additional power and speed, you walk into this serene environment, it's gently lighted and it's silent. There's a gantry turning inside at 4 times per second. It's generating 70 Gs of force, and it's suspended magnetically. You can't even hear it. It's just the craziest. You got to go check it out. It's amazing. It's open. It accepts large body mass index patients, and it's really designed, the whole suite's really designed for patient comfort to make it very accessible. So if you haven't been, please come, and we'll be happy to give you a tour.
Mr. Sheldon?
So I was interested a couple of 3 weeks ago when you had your open house and that as to the finesse of the thing. And I talked to Dr. Connick a few minutes ago at the beginning on cleaning house. And we did a brochure, or the hospital did a brochure back in the winter of '85, 30 years ago. But the headline is "The Scanner on Wheels" had just been purchased. And so the progress from 71 to 85 to this thing is so significant in what it can do to help our patients, and the foundation is certainly to be commended for helping and raising the funds necessary to do this.
Thank you. So, speaking of the foundation, how about a report, Glenn?
All right. Whoa, we're a little too far. Let's get back to. Well, speaking of this, we're hoping this plays. Do we have any IT support in here? All right, we'll just wait.
Terry.
Here we go. Actually, go ahead and watch the screen. We did a a time lapse of them, of the staff assembling this GE Revolution. Everything condensed down into about 1 minute. I'm sorry you can't hear the sound. But we followed this. We actually started tracking it the moment it rolled off 3 trucks and into the door. And you can kind of see what's involved. There we go. We are actually pretty proud that it is the first in San Diego and the first in SoCal. So we wanted to share that with you guys. It's something we had fun making. And it took a while, you know, it took a couple of weeks for them to put that together and to condense it down. Was actually a lot of fun. Foundation is also welcoming 2 new board members recently. First is Daryl Palant, who is a VP and Assistant General Manager at Caesars Entertainment. He works at Harrah's in Valley Center. Very involved in other organizations in the community. We were fortunate that he chose to join the foundation board. And Don KOCT from Advantage Home Health, who's, again, very connected to the area and has worked extensively with and around Tri-City. We're happy that they've joined us. That brings our board complement to 20 members. We just had a brand new board member join. We'll be presenting her at our next presentation for you guys. And we're probably going to be a little bit strategic moving forward on adding additional board members. Our bylaws allow us to add up to 29. And so as we look forward to bigger projects and bigger things that the hospital is looking at, we'll do some strategic recruiting and probably fill out the board. It's a really good problem to have when you're filling up your boardroom. And I think at the next meeting, we're going to have to actually add another table. And people are excited and energized and happy to be involved. So I'm proud to report that to you guys. Now, updates on a couple of events that we sponsored or were involved with. As you may have heard, the foundation helped bring in Dr. Don Teeter to do a presentation on the illusion of opioids, the dangers of overprescription of opioids. And I'm happy to report that over 150 people attended his seminars. I think there were 47 physicians during the week he was here. Dr. Teeter volunteered his time to come and spend the week with us. And these are just some of the comments we had. The feedback was absolutely incredible. In fact, the negative feedback said that we needed him here longer and his presentations needed to be longer. So we were very, very excited about that. And also, David Bennett arranged for, in our marketing department, arranged for Dr. Teeter to be interviewed for, it was an NBC News story on this subject, which is still to air. Yeah, still to air. So we were thrilled to be involved with that. That was something I think you may see the foundation more involved with. And this was a result of some grant funding we had to be able to bring this national expert out. This past weekend, we had our 3rd annual Tales on the Trails event at Mance Buchanan Park in Oceanside. We had actually a sold-out event with 200 guests. Special thanks to Directors Nygaard and Shalek for joining us. And I'm happy to report our collaboration with the auxiliary netted over $11,000, which is divided between the 2 organizations. And so the auxiliary will be supporting pet therapy and some of the other local organizations with their proceeds. And of course, everything we raise goes directly back into the hospital. So we thought it was a great event. Our guests had fun and we had a great turnout. So we'll look at continuing this event next year. Now on to some new events which you will see coming up. First is the 20th Annual Tri-City Hospital Foundation Golf Tournament. We've moved the location this year to Vista Valley Country Club. As we sort of look to reposition some of these events, we've tended to do things at the same places over and over again. And we had the opportunity to really significantly upgrade the event. And so we're going to give it a try. Vista Valley is an incredible course, and I don't know if any of the directors are familiar with it, but it's in sort of the back rolling hills of Vista. It's a beautiful, beautiful location. It's a private club, and not many golf tournaments, charity tournaments especially, have been played there. So we think that our corporate council partners and our foundation partners will really enjoy this experience. And we're looking forward to a great event. And one we haven't really promoted yet in the community too much, but that a lot of people seem to know about, is Jay Leno is joining us for our Diamond Ball this year. Tickets are on sale. They are actually selling well. We haven't actually really promoted it very much, but you'll see that moving forward, a very, very heavy promotion. So Jay's agreed to come in and perform for us. He'll present our Legacy Award. He'll assist with part of our auction, and he'll do a full 1-hour comedy performance, as well as making himself available for a special VIP meet and greet after the show. So we moved the event to Omni La Costa to accommodate the demand that we're seeing in initial tickets. And I think that some of the comments, actually the first tickets we sold, we sort of just put this up online and really hadn't done the promotion yet. But somehow, people talk, and it leaked out a little bit. The first 2 tickets were purchased by somebody who has never attended a hospital event like this before, and just were excited that we were doing this. And so for us, it's a way to get people that haven't really been connected to the hospital involved, and to learn about what we're doing. So we're really excited about that. And also, the last thing I have for you is we're starting a brand new Grateful Patient program here in the next 30 days, which will reach out to those folks that have had good experiences at Tri-City, and we'll work to connect them back to additional Tri-City services. So it's something that has been done very successfully at other hospitals, and we're introducing that here into our district. I'm happy to entertain any questions you might have. Actually, Director Fenella, I visit her nearly every week. Good for you. She's become a dear friend, and she is one of the most passionate supporters of the hospital in the community. And so we're honored to have her.
My colleagues, any more comments?
I just have to say that Tales on the Trail was so much fun this year, and it was really hilarious to see the variety of dogs there are in the world. If you have never gone, you should go just for that opportunity, because it was great fun.
And we do have some pictures on our Facebook page. We tried to get a nice selection of the dogs that were there. Big one, and personality. Personality. There are a lot of not small dogs that consider themselves babies and like to be held as such. So that's always interesting. So thank you for your support. And I wanted to mention, too, that the proceeds from this year's Diamond Ball will first be used for the renovation of the labor and delivery mother and baby. That's a project that has already been approved by the state authorities. And so we look forward to starting that hopefully in July, starting those renovations. So thank you.
Glenn, I want to personally thank you and the foundation. We talk about bringing talented people like Dr. Ben Heim here. We talked about our building program, about retrofitting and all of that. But we forget that these talented people need that up-to-date equipment, that modern stuff, to help them do their job. I want to thank you for helping us do that and provide that for them.
Our pleasure.
Thank you. So with that in mind, can we have a report from the Chief Executive Officer?
Good afternoon. Well, how about the 512 slice scanner? Unbelievable. We just heard from everybody on it, but an amazing technology, and it shows the true community collaboration. We've got the foundation, the auxiliary, the medical staff, board of directors, everybody coming together to bring better technology to the district and the community that the district serves. It's exciting. Thank you to Dr. Don Ponick, somebody who actually understands what it can do, explaining to us what it can do. And we look forward to hearing more stories about how that assists with patient care in the future. Congratulations also to the Nurses of the Year. I was able to attend that day when they were honored, and compelling stories about patient care every single day. So that's what nurses do every day. They take care of patients, and that's why we're here. It's all about patient care. And while we're talking about that, I'd like to take a moment to recognize Tri-City's Chief Nurse, Sharon Schultz, for her continued caring, compassion, commitment to Tri-City. She's unbelievable every day. And welcome to Tri-City, Dr. Sharona Benheim, an exciting addition to Tri-City's community. We couldn't be more pleased that she has chosen to share her wealth of knowledge and medical expertise here at Tri-City. And thank you also to Dr. Greg Sahagian for taking the time to come here and participate in the process as well. A lot of exciting things going on. We're making progress regarding the Crisis Stabilization Unit. We've been working on this project for quite some time, had recent meetings with the county, and we believe that we will be entering into a contract soon and bringing a Crisis Stabilization Unit to Tri-City sometime this summer. So more to come regarding that, but we look forward to that creating an improved patient experience in the ED and in the Crisis Stabilization Unit as well. So that's another exciting project. Next month, we'll be bringing the fiscal 17 budget to the board for consideration. So we'll go through our strategic plan, how that's rolled into the fiscal 17 budget, and what that means for Tri-City moving forward from a fiscal perspective. And I'm happy to report that Tri-City is back in the black with a bottom line positive result this month, which you'll hear from Ray Rivas in a couple of minutes. And just want to remind everyone that Tri-City, from a safety rating from Leapfrog, a national organization, was rated an A 6 times running. That's based on patient safety. Nothing more important than patient safety when you come to the hospital. Our value statement is the needs of our patients come first. We mean it. It's an A rating. The difference, there was a study that was done at Johns Hopkins that shows the difference in risk of avoidable mortality between a C and an A. It decreases 35%. That's a staggering number. So when you think about patient safety and where you go for your health care, come to Tri-City. Thanks. Question?
Colleagues?
As has been pointed out, there are many good stories that emanate from Tri-City Hospital, and we would be remiss if we didn't try to tell the story of the accomplishments and the advancement of our values and of our programs. And Steve has taken the leadership as CEO here, and we are most grateful for your caring, as much as we are grateful for the caring of the nurses and doctors. So thank you very much.
It's a collaborative. It's a collaborative effort for the entire community, and it takes everyone. I'm fortunate to have the opportunity. Thank you.
Any more comments from colleagues? Then let's hear about our financial health, Mr. Reeves.
Good afternoon. This is the financial report for April. Starting with our year-to-date numbers, through April, we have operating revenue of $278.8 million. We were budgeted to make $287 million. Prior year, we were at $278 million. Operating expenses year-to-date are $281.5 million compared to a budget of $285 million. That's a favorable variance of $3.5 million, and a prior year of $278 million. Since January, we've been reporting EBITDA and the ROE with and without the impact of our OIG settlement. EBITDA excluding the OIG settlement is 13.8 million year-to-date compared to a budget of 20.3 and a prior year of 16.3 million. EROE excluding the settlement is 1.9 million versus a budget of almost 6 million for an unfavorable variance of 4.6 million and a prior year of 3 million. Key indicators year-to-date, our average daily census is 193. We were budgeted for 200, and we're equal to our prior year of 193. Adjusted patient days are 94,831 versus a budget of 96,500 and a prior year of 94,000. Surgery cases year-to-date are 5,363. We were budgeted for 5,720. That's unfavorable to our budget of 6.2%. In a prior year of 5,577. Year-to-date, we have 2,157 deliveries. We were budgeted for 2,461 and a prior year of 2,165. ED visits year-to-date are 55,000 versus a budget of 59,000 and a prior year of almost 59,000. Results for the current month, operating revenue was $29,300,000. We were budgeted for $29,800,000. We had operating expenses of $29.5 million versus a budget of almost 8 million. We reported EBITDA of $1.5 million. We were budgeted to make $2.9 million. And we had an EROE profit this month of $331,000 versus a budget of $1.5 million for an unfavorable variance of $1.1 million. Key indicators for the month, our average daily census was 201 compared to a budget of 204. Adjusted patient days, 9,661 versus a budget of 9,636. We had 550 surgery cases compared to a budget of 577. 189 deliveries compared to a budget of 253. And 5,182 ED visits compared to a budget of 5,896. We're reporting our average AR for several years and our days in AR. For the current year, we're averaging $41.8 million in net patient AR. That's down from a prior year of $43.1 million. Days in AR is 48. That's down from prior year of 49.2. And this is just a graph of our net days in patients' accounts receivable. You can see we spike up in January. That's due to our ICD-10 conversion. It comes down pretty quick. That's as a result of the wonderful job our HIM department did in getting the hospital through this conversion. Average daily census, we spiked up in April. Adjusted patient days follows that trend. Our ED visits were down in April after spiking up during the winter, during the flu season. And this last slide is our EBITDA and EROE by quarter. We talked about this last month. This last quarter includes the OIG settlement of $2.2 million. Otherwise, April is trending the correct way. So that's the report, unless there's questions.
Colleagues, any questions? Thank you, sir, very much. Now let's move on to the new business. This is always a fun topic, isn't it, Mrs. Nygaard? So can you lead us on the subject matter?
I certainly can. We are so happy to present to you the proposed community health care grant for the coming year. Chief Gleason and her committee have worked so hard this year. It's not easy giving away money, and we have to do it truthfully. But we have so much to thank her and her
Thank you, Director Nygaard. This year, we received 34 applications with a total ask of just under $1 million. When you have $300,000 to give away, that seems like a lot of money until the asks alone are 3 times that amount. And that's just from the organizations we're hearing from. We appreciate the work of all of the nonprofits in our communities and are happy to recommend funding for 19 of the applicants. You have received the list along with a brief summary of the projects. As I am sure you have noticed, most of the requests fall under the category of mental health. The panel was acutely aware that the board is committed to addressing the mental health concerns in the district, and we believe the recommendations reflect that. We thank you for the opportunity to share these important programs with you and appreciate your support. I am happy to do my best to answer any questions you may have.
Thank you. Any questions, my colleagues?
As you have pointed out in the past, is that the green far surpasses the amount of money that we can give. A couple of these recipients of the grants get a large amount of money from other sources. Do you check their past history and make that a determination of what they're going to be getting each year?
Yes, we do. If an organization is requesting for a project they have already received funding for, like the year before, then if we feel that it's viable to the district, we will continue to recommend it, but at a lower amount, because the hope is that these organizations will continue to look for alternate funding, and we don't want to fund any more project more than 3 years in a row. So we're kind of weaning them off the process. Does that answer your question?
Any more questions?
I don't have any questions, but I just have to really thank the committee. This is a difficult job, but it is really vital to all of those organizations in our community that look to us. It's one of the gifts that we give back, and I think we've done a wonderful, amazing job of being fair.
Thank you. We enjoy the work that we do. Thank you. Thank you for your support.
And again, I appreciate your fairness in the process, and I appreciate the credibility that you guys go through in actually granting money. So thank you.
You're very welcome. Thank you.
Okay, so then let's move on to some of the business items.
Wait, we need a motion.
Please, sorry.
I move that Tri-City Healthcare District Board of Directors approve the fiscal year 2016-2017 Community Health Grant Awards in the amount of $300,000 as recommended by the Community Healthcare Advisory Committee.
Second, thank you. Any discussion on the items? All in favor of the motion, please say aye. Aye. Opposed? Hearing none, the motion passes. Then let's move on to item 18B, which would be the nomination of a community member to the CHOP Committee.
I move that the Tri-City Healthcare District Board of Directors appoint Ms. Sandy Tucker, Senior Commission nominee for the City of Oceanside, to a 2-year term on the Community Healthcare and Alliance Committee as recommended by the committee.
Second, thank you. Any discussion?
Could we do all of these in one motion?
I think that makes good sense. Shall we amend your motion, Director Mitchell, to include all of the items, which would be items B through F?
Could I repeat their names?
Please go ahead.
Okay, so there's Sandy Tucker, Mary Donovan from Vista, Mr. Dung No, a multicultural representative, Ted Owen from the City of Carlsbad Chamber, and Mary Murphy from the City of Carlsbad Police and Fire. Move approval of all. Move approval. I am. So, second.
And there's a second. So I don't see any of the members here who would like to speak, or are there any members who would like to speak? Nominees? None here. Then any discussion? All in favor of the nominations, please say aye. Aye. Opposed? Thank you. So let's move for the report on the ad hoc committee.
The same day check was held, we had our first presentation from turn me down a little bit, please.
I don't have volume control.
There we go. For a product called Board Effect. And so Director Shallot, Director Nygaard, and myself interacted with the lady from Board Effect. And I was pretty impressed with the degree of versatility. You can create workrooms, you can create workbooks, you can access it from, you're given a website address, so versus an app, so you can access it from any kind of a device. So I'll be setting up the next presentation from the Governance Institute for June, because they have a product similar. And I'll be looking around for at least one or two other similar products. So, so it was our first introduction to the whole concept. So we're taking our time and doing our research.
Is there any thought about when we might see a recommendation from the committee? I see a head shake.
What I want to do is I want to look at all this stuff. For example, Board Effect actually would offer us a trial just to see if we liked it. But I want to see, you know, look at different systems, what are the similarities, what are the differences, then look at what we're actually doing. Would we go all electronic, or would we have a hybrid system where some of it is still on paper? So, and work out the policies and the procedures that are going to be needed. So I want to do this well from the beginning. So, and the technology isn't going anywhere. So I just want to do this thoroughly and well before we before we look at implementing.
Thank you. Some of us are very excited about this, as you know. So, but thank you very much for your effort, guys. I appreciate it. Thank you. So, can we move on to the Chief of Staff report? And I gather we will need a motion for that. Bob, do you have any discussion regarding that?
Yes. Oh, there we go. Thank you. I know that some concerns have been raised about one of the items, which is the proctoring as it relates to current competencies and how certain physician privileges or competencies are actually removed. And it definitely is a concern. And it's a concern because it's obviously a very sensitive issue. And, you know, the analogy obviously would be like riding a bike. If you know how to ride a bike, you always know how to ride a bike. But I think if in an organization such as ours that puts such a premium on quality of care and safety, it's not good enough just to remember how to ride a bike. You have to be really good at riding that bike. And so we do have processes in place in which certain procedures that physicians may have trained on but may not be regularly using, you have to demonstrate current competency, or unfortunately, and that includes myself and all my colleagues in the emergency department, if you're not doing it regularly, it falls off your competency list and you have to demonstrate retraining in order to regain that. So I know that there's some concerns about that. It's obviously a big concern of ours, but in the interest of this is how you get to 6 straight leapfrog A's, in the interest of an organization that puts quality and safety first above all else, it is the direction that we feel is the right way to do it. And one other comment I wanted to make was I had an opportunity to speak to a forum this last week. And as I was going through it and talking about all the really exciting things that were happening at Tri-City, you really forget how many great things are really happening here. Welcome to Dr. Binheim, really excited about the UCSD affiliation, but so many different things that are happening, and I won't reiterate that list. We've gone through so many of them. But when you put it all together, I was asked, how does that happen? It really happens because I realized that the board has done an incredible job of leadership here. As you know, historically, the medical staff has been the first to be a little bit critical when things, from a leadership standpoint, haven't been right, or at least in the medical staff's perception. So I want to say that from our perspective, things are right, and you guys doing a phenomenal job. And the leadership that Mr. Dietlein has shown, and the commitment to quality of care, it just makes you feel really good about the things that are happening here. So.
Thank you very much. I think the public doesn't always know that physicians don't just show up on our doorstep and set up shop and practice here. You have set up criteria, and you want a certain caliber of physician to practice in this community. And I commend you for sticking to those standards. That's what this credentialing calendar is about. That's what the reappointment calendar is about. And Jean Ma is a stickler for making sure everybody follows the rules. So thank you for doing that. I'm going to ask the maker of the motion, shall we consider both items A and B in this motion too, while we're being efficient? Yes. Great, great, thank you. So, any thoughts about the credentialing report? All in favor, please say aye. Aye. Opposed? Thank you. So now let's move for consideration of the consent calendar. Can I have a motion? Thank you. We have Ms. Nygaard, Mr. Schelick. Now, let's talk about any items we want to pull from the consent calendar. My colleagues, any items that you think want to be pulled? So hearing none, why don't we move to approval of a vote on the consent calendar? All in favor to approve the consent calendar, please say aye. Aye. Opposed? Thank you. So what we now have is any discussions about the reports, and they are discussion items. So, and that would be our dashboard, our construction report, lease report, reimbursement disclosures, and seminar conference reports. Does anybody have any information regarding that? We'll want to have some discussion. Yes, ma'am.
Earlier this month, Director Nygaard and I attended the Association of California Healthcare Districts annual meeting in Monterey, where the weather was much nicer this year than it was last year. And we're also, Director Nygaard was elected chair of the HCHP board. So, we actually, although Director Nygaard is going to talk probably a little bit more about it, but one of the speakers that was there last year spoke again this year, except last year he was with Google Health, and this year he is with Lyft. But it was very interesting, and actually the funnest part was the last speaker, who was the last-minute substitution, a man named Jim Tunney, who spent 40-plus years as an educator, alternating with being an NFL referee. So naturally, all the questions from the audience were about football. But yeah, I think it was the whole conference was well organized, and they sort of focused on more stuff that we're all facing right now versus some theoreticals.
Thank you. Any other comments about the reports? And then let's move into the legislative update, and I think I'd like to turn this over to Mr. Dietlein, because he has some thoughts about a couple of bills that are coming up, and he has been intimately involved in talking for those bills. Sir?
There's a few bills of note. One, SB 957, known as a design build, and that's to utilize design build process for purposes of building healthcare facilities. So as we look forward to campus redevelopment, that's something to keep an eye on. It's passed off the Senate floor. It's headed to the Assembly right now. And another is AB 1300, which is a bill to improve standards in the Lanterman-Petrus Short Act, otherwise known as LPS. And we know that as basically the involuntary holds or locked unit, which Tri-City has. So that bill is to streamline the evaluation, assessment, and release process for individuals who may be on involuntary hold.
Thank you. Thank you very much. So with that in mind, do we have any comments from the public? Then let's go to the board communications. Mr. Sheldon?
Three things, I think, before. I just wanted to tell you that for those of you who've been on the board for a while, Sal Ramirez, who was in facilities management, was one of the first hires here, passed away earlier this month. His daughter-in-law called me last fall and told me that he was very ill and had showed his wife, if you recall, his wife had passed away just around the time that he left the facility, and we did recognize him for all of his services, but he chose not to go forward with any extra treatments, and so anyway, he did pass away, and so I sent her a note, just to condolence to the family, but also, again, how much we appreciated all the time and effort which he put in to Tri-City from almost day one. Yeah, it was over 50 years. So second thing was Mr. Bennett had, well, if you recall, the last 2 months, I've talked about the prescription drop-off thing. And so the update is that when they have the take-back facility out here in the parking lot on that Saturday, there were 471 pounds of medications that were turned in, and the DEA or whatever body was out there destroyed. And I think it was a huge number, but in North County, Tri-City led the numbers. And so to the people who took the time to drop it off, a couple of things. One is that we don't want people to throw them down the toilet or in the trash. And then the other part is because we have concerns related to the misuse of people getting into grandparents' medicine cabinets and that, it gets them out and away. And so the community is to be commended for doing that. The other thing is, just as a comment, San Clemente Hospital is scheduled to close next Tuesday. And with the changes in how healthcare are going, if you recall, Kapua certainly is familiar with that. A couple of years ago, Fallbrook Hospital closed. San Clemente is now closing. On the I-5 corridor between Oceanside and Mission Viejo, there now will be no hospitals on that. And so, but they don't have the volume to function, and they tried to get it as a standalone ER, but that has so far not been successful. So it's just something that is part of the competition of how healthcare goes. And my last is to Julie, to congratulate her. We've had many people involved with ACHD. ACHD is all the district hospitals in the state of California, and so certainly your peers recognized you that you interact with, and we very much enjoy or look forward to your continued leadership, both here and there. So,
Thank you, Mr. Sheldon. Ms. Mitchell?
Just my congratulations to Director Nygaard for being elected chair of the ACHD board.
Thank you. And Madam Chairwoman?
Thank you. I don't know if it's congratulations or condolences. It's going to be a lot of work this year. Apparently the legislature is focused on special districts, and we're going to have to help them understand how valuable we are to the community. And I really do want to take a minute and just thank everybody in this hospital who works here, because our community is so lucky to have an outstanding community hospital that's focused on making sure that the care that we provide is the very best and the safest. And I think we have to all recognize how very good this hospital is for the community and how lucky our community is. So I got my work cut out for me this year. Yes, as I said earlier in one of my comments, that there are a lot of good stories that we have to share. One of the very good stories that I heard coming out from the community was how well a presentation on the rapid response team was given by Ms. Suzanne Grimm. And seeing that it evoked such a response, I would like us to try to schedule her or someone in that program to come and tell us a little bit more about it so that the community understands that I think it would be a very good thing. And that's all I have to say.
Thank you. Any comments?
Just congratulations to Julie, and I know she'll represent our interests, and we do have interests. We have to pay attention to what those people in the state are doing.
Thank you. Will I get the final word? And I'd like to tell you about my spring trip to Washington, D.C. It is outlined in your agenda packet, but I get to present to you because I was fortunate enough to represent Tri-City at the American Hospital Association annual meeting, which brings all the people who deal with hospitals to talk about what's coming up and what things we are to expect. Also, the California Hospital Association does its legislative day. And I was fortunate enough to represent Tri-City with our San Diego team, our colleagues from Scripps, Sharp, Kindred, UCSD, and Kaiser, about the legislation coming up and how it affects each of our representatives that we serve. We were fortunate enough to be paired with 5 states to have a special presentation from the chiefs of staff from the key legislators regarding what's going to happen in the next 6 months. Because as we learned, okay, everybody is really excited in Washington about who the next president is going to be. And that means all their jobs are going to change. So their bosses want them to do their work and get things done. Chief of Staff of Senator Charles Schumer, Nancy Pelosi, and the Republican ranks and Democrats Chief of Staff. Illinois, California, New York, Pennsylvania, Florida, all of us got together and had a special presentation. There was no press allowed in the room, no notes were to be taken. They were going to give us an honest straight up of how they see the world. And how they see the world is this. Obamacare has insured another 10 to 15% of people. They recognize that, but there is no more funding dedicated to pay for those people. Most of them have been incorporated into Medi-Cal plans, Medicaid, but many of them have bought the Obamacare policies. Those policies have been subsidized, some of the premiums, by federal monies, but they don't know where they're going to get that money. These premiums are for policies that are $5,000 deductibles and some up to $40 to $60 copays. And the legislature recognizes that that's an awful burden on people, and they expect that those premiums are going to go up because the care provided last year to those people was far greater than the premiums could support. So, with that in mind, all the chiefs of staff have plans as to what they're going to do. The first thing they're going to do is to add to the 220,000 regulations that this administration has proposed over its 8 years. They're going to add to those regulations. And many of them are healthcare regulations. And believe it or not, what they said to us is every regulation that they proposed is going to improve the quality of healthcare. Every single regulation is going to make the care better. The second thing they're going to do is they're going to have to fund these shortcomings. Because what the Hospital Association provided for us was, they showed us what our Medicare funding is going to be. Here is where we are in 2016. And this is where we're going to be in 2015. Each year we're going to get less money to do what we do. And that's based on the pending regulations that are proposed, the regulations in play, and the funding that's been proposed. So what's going to happen is more regulations are going to occur, and you're going to get less money to do it. When asked how they were going to handle this funding crisis, here was the answer. They've got big pots of money in healthcare. And what they're going to do is they're going to take these pots of healthcare and shift the monies to different pots. And that, by the way, is going to improve the quality of healthcare. Same amount of money, they're just going to shift the pots. So, that mean for Tri-City? What it really means is, gang, we don't have any help from the east about how we're going to handle this. We're on our own. It's going to be up to Sharon and the team. You heard from Steve that we're going to be meeting on June 1st to talk about our strategies and our quality issues, and that's to try to keep those 6A ratings regarding our safety issues. And then Ray is going to hopefully find out when we hit our budget issues where all these pots of money are hidden, and hopefully we can dip into those pots to try to help our citizens. But that's the challenge we have. And I think that I am very proud to work with this team, a group of seasoned veterans. If anybody's going to figure out this problem and figure out how to take care of our citizens, it's going to be our team. Sharon's got to sift through all these regulations and tell us how we're going to get around it, because the key to the safety of healthcare is our physicians and nurses, our eyes have to be kept on our patient and not worrying about checking boxes. So, ladies and gentlemen, that was my spring trip to Washington, and that's what I learned last month. Thank you very much. And I guess if there's no more comments, let's consider this meeting adjourned. Thank you.
You're adjourning back to closed session.
Yes, we are adjourning back to closed session. Thank you, Council.